This is my surveillance check, my patient. She's going to record. Hello, my name's Gabby. I'm going to be your nurse practitioner soon, doing your physical assessment today. From what I was told, you were having some joint stiffness and pain in your knees and some swelling. Is that right?
That's correct.
Yes? Okay. So let's do an exam. And if you have any questions at all during it, please feel free to ask me.
Okay, great.
Okay. So before my patient came in, I assessed his musculoskeletal system. Gait was steady, posture was erect, he was appropriately dressed, he is well nourished. Patient is 59 years old. Vitals were also done beforehand. Blood pressure was 128/72, heart rate of 76, respiratory rate of 16, oxygen saturation is 98, and temperature is 98.8. Just looking at his skin here quickly, it is white, it's consistent with his race here, he's warm, he's dry, there's no skin tinting there. Okay, so can you tell me your name and date of birth?
Sure, it's Jeffrey Ukleja, October 9th, 1962.
Perfect, and can you tell me what date today's date is?
November 23rd, 2021.
Perfect, do you know where you are?
That's West Haven Walk-In Clinic.
Perfect, and who's the president?
Biden.
Perfect, okay, I'm going to give you 3 words to remember. I'd like you to remember them now and later. The words are banana, sunrise, and chair. Can you repeat those back?
Banana, sunrise, chair.
Okay, perfect. Now I'd like you to do some serial subtractions, of 7s from 100. So starting at 100, keep subtracting 7 until you get down to 0.
Sure. 100, 93, 86, 79, 72, 65, 58, 51, 44, 37, 30, 23, 16, 9, 2.
Perfect. Now I would like you to draw a clock for me.
Okay.
Do you need glasses? And I'd like you to put the numbers on it and then label the hands as 10 past 11. Perfect. All right, now what were those 3 words I told you to remember?
Banana, sunrise, chair.
Perfect. So patient is alert and oriented. Mini-cog score is 5. Now moving on to his head, there is head is symmetrical. There's no lesions, no lacerations, no trauma noted. I'm just going to take a feel here. There's no lumps, no masses felt here. Face is symmetrical. There's no scars, no lesions noted. Next, I'm just going to feel your temporomandibular joint. Please open and close your mouth. Perfect. Any tenderness there?
Nope.
No, so no clicking, popping, or crepitus felt either. No tenderness. Next, I will assess your sinuses. Please let me know if you have any pressure or pain at all, okay? Frontal? Ethmoid?
No.
Maxillary?
No.
Perfect. So no pressure, no swelling, no tenderness there at the sinuses. Now we're moving on to the sensation in your face. So for this, I'm going to use a Q-tip. I'm just going to have you close your eyes. I'm going to touch multiple spots on your face. Just let me know when you feel it.
Yes, 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 yes.
Okay. Were they the same on each side?
Yes.
Okay, now I'm going to do the same exact thing, but with the dull side.
Okay.
Close your eyes. Yeah.
Yes, 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 yes.
Perfect. And it felt the same on both sides?
Yes.
Okay, good. So cranial nerve 5 is intact, and the muscle tone is symmetrical, and there's no fasciculation there. Now we'll assess cranial nerve 7, which is looking at your facial muscles. So for this, I'm going to have you raise your eyebrows for me. Perfect. Now close your eyes real tight. Good. Now you can puff out your cheeks and purse your lips. Good. Now show your teeth. Perfect. So facial muscles are symmetrical there. Moving on, your eyes, I don't see any crusting or the eyebrows or the eyelashes. The sclera is white. The conjunctiva is pink. There's no paleness there. I'm now going to assess your pupils and your lens. For this, I'm going to shine the light in your eye. Just please take a look for me on the back wall there and just focus on one spot. Perfect. 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 So pupils bilaterally equally round and reactive to light. Next, I'm going to assess cranial nerve 2, which is your vision acuity. I'm going to have you take a stand right here. I'm going to have you read the modified Snellen chart, which is at 6 feet from the patient. Cover one eye and read the lowest line that you can.
DHJBS.
Perfect. And now the other eye.
DHJBS.
Perfect. Vision is at a 20/20. Now I am going to test your peripheral vision by confrontation testing. So for this, I'm going to have you look straight forward at me and let me know when you can see my hands in your periphery.
Yes. Yes.
Perfect. So peripheral vision is intact. Next, I will assess extraocular eye movements, which is cranial nerve 3, 4, and 6. I want you to keep your head nice and still for me and just follow your my finger with your eyes. Now into your nose. Perfect. So convergence and pupillary restriction was noted there. Lastly, I'm now going to do a fundoscopic exam. For this, I'm going to use my ophthalmoscope. I want you to take a look on the other side of the wall over there. Just pick one spot and I'm going to shine the light in your eye and take a look at the inside of your eye. Okay? Okay. Now the other one. Okay. Perfect. So optic discs were yellowish orange. They were sharp, well defined, and the red reflex was present. It was intact there. Moving on to your ears, I don't see any drainage. I don't see any erythema here noted on either ear. I'm going to assess cranial nerve 8, which is by performing the whisper test. This is to assess your hearing. I'm going to stand on your side, cover one ear, and whisper into the other ear. Let me know what it is that you hear, okay?
Yep. Apple.
Good. And now the other side.
87.
Perfect. And now I will perform the ring test. I'm going to strike the tuning fork, put it behind your ear, let me know when you can no longer hear it, and then I'll move it to the front of your ear. Same thing, tell me when you can no longer hear it.
Okay. Okay. Okay.
Okay. And again.
Okay. Okay.
Perfect. So no conductive hearing loss there. Air conduction was greater than bone conduction from 2 to 1. Now I will assess your hearing by the Weber test. For this, I will strike the tuning fork and put it at the top of your forehead here. Let me know if it sounds greater on one side versus the other, or if it's the same in both.
Okay. Same.
Same? Okay, so there's no lateralization there. Now I will... Now I'm going to perform the tug test. This is to look to see if there's, if you feel any pain or tenderness in the ear. This can signify inflammation or infection. Any pain?
Nope.
No? What about this one?
Nope.
No? Okay, good. Now let's take a look inside your ear. Come on, right here. No, not you. Okay. Okay. Tympanic membranes are pearly gray. There's no redness, no bulging noted. Now moving on to your nose. Nose is symmetrical. There's no deformities there. I'm going to take a look on the inside of your nose now. Okay, and now the other side. Good. So both nostrils, the mucosa was reddish pink. There's no polyps, no drainage seen. There's no septal deviation either. Next, I'm going to assess for the patency of your nose. So for this, I would like you to occlude one nostril for me and just breathe as you normally would with your mouth closed. Good. Now the other side. Perfect. Okay. Nostrils are patent. Breathing was noiseless. Now I'm going to assess cranial nerve 1. This is looking at your sense of smell. So for this, I'd like you to close one nostril and close your eyes. Tell me what it is that you smell.
Peppermint.
Okay. Now the other one.
Orange.
Perfect. So cranial nerve 1 is intact. Moving on to your lips. I see no lesions, no cracking. There's no sores there. I'm going to assess cranial nerve 9 and 10. This is looking at your soft palate and your uvula. Please open your mouth and say ah. Okay. So mucosa is pink. Uvula is midline. Soft palate is symmetrical. Gag reflex is intact. The teeth are an ivory color. And the tonsils were pink and they were within the tonsillar pillars as well. Now I will assess cranial nerve 12, which is examination of your tongue. For this, please stick your tongue out. Good. So there's no deviation there. Now please, with your tongue, touch my finger, on the inside of your cheek and the other side. Perfect. So tongue is symmetrical. There's no fasciculation. Moving on to your neck. Neck is, there's no goiter, there's no torticollis, there's no lesions present. It's symmetrical on both sides. I'm going to start by assessing your lymph nodes. Please let me know if you feel any tenderness, okay? Preauricular, postauricular, tonsillar, submandibular, submental, anterior cervical, posterior cervical, supraclavicular, infraclavicular, and occipital. Any tenderness?
Nope.
Okay, perfect. So no tenderness. There's no swelling, no grittiness feeling there either. I'm going to now assess your trachea. I'm just going to feel on each side here. Trachea is midline. I'm going to move down to your isthmus now. Please take a swallow for me. Perfect. Was there any tenderness?
Nope.
No? Okay. So no tenderness of the thyroid, no gritty sensation, no nodules felt. Now I will assess cranial nerve 11, which is the power in your shoulders. So for this, I'd like you to shrug against my resistance. Perfect. Now push against my resistance. And the other way. Perfect. All right, we are going to now start with your carotid artery. I'm going to take a feel here. We're at a 2, and I'm going to take a listen. No bruise heard there. I'm going to assess for JVD now. For this, I'd like you to please lay down at a 45-degree angle here. I'm going to have you turn your head to the left side for me. Bring this arm up. JVD measurement is 7 centimeters. Perfect. Now I will assess for the point of maximal impulse. You need to move. So I'm going to take a feel right here. Good. Point of maximal impulse is at the 5th left intercostal at the midclavicular side. Now let's take a listen to the heart. Start with the aortic at the second second right intercostal at the right sternal border. Pulmonic is the second left intercostal at the left sternal border. Tricuspid is at the 4th left intercostal at the left sternal border. And lastly, the mitral, which is at the 5th left intercostal at the midclavicular line. Good. So S1 and S2 sounds are heard. Heartbeat was regular. There's no murmurs, no friction rub there. Next, I will palpate here for, you have at your second rib right here, you have the angle of Lewis. Now I'm going to feel for any heaves, lifts, or thrills. No heaves, lifts, or thrills felt. Looking at his breathing, breathing is symmetrical. There's no deformities or masses on the thorax here. I'm going to now take a listen to the breath sounds. Breath sounds are bilaterally equal and clear on both sides. Next, I will test for egophony. For this, I'm going to take a listen on your chest and let me know if you, and I want you to say the letter E for me, okay?
E, 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 E.
Good. So egophony was negative. There is no consolidation there. Next, I will percuss the lung fields. I'm going to start on your back here. Good. Now I'm going to have you kind of bring your arms up over your head for me. Good. So resonance was heard on percussion there. Now feel for any kind of tactile fremitus. So for this, I'm going to place my hands back here on your back. I'd like you to say 99.
99.
Perfect. So tactile fremitus was equal and symmetrical in the back. Now moving on to your abdomen. Abdomen is symmetrical there. I do see 3 scars here on the right side. I don't see any kind of lesions. I don't see any kind of nodules here. I'm going to now take a listen. I might actually have you lay down for me. Perfect. Good. Abdominal sounds are normal, active in each quadrant. Now I'm listening for abdominal bruits. Start with the aortic, renal, iliac, and femoral. Good. No abdominal bruits heard. Now we're going on to percussion. Tympanic percussion was heard throughout. Now I will assess liver span. Liver span is 9 centimeters. Now I'm going to palpate. First, I will do a light palpation. I'm looking for any masses. I'm feeling for any tenderness. If you feel any tenderness, let me know.
No. No. No.
Good. So there's no guarding or tensing, no resistance, no masses, no tenderness, notice. Now I'm going to do a deeper palpation. Let me know if you feel any tenderness.
No. 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 No.
Good. So no masses, no tenderness there. Next, I will assess for ballottement. That's to assess each kidney. I'm going to come on this side here. Okay. And now on this side. Perfect. Now I'm going to have you take a seat for me. And I will assess CV angle tenderness in the kidneys. Okay, so I'm going to percuss back here. Let me know if you feel any tenderness. No?
No. No.
Okay, good. So no tenderness noted. Now I'm going to move on to your spinous process. I play for you to please stand up. Let me know if you have any tenderness when I feel here, okay? Cervical spine.
No.
C7 and T1.
No.
Thoracic spine.
No.
Lumbar spine.
No.
Perfect. And
No.
sacral. Perfect. So spine is aligned. It's symmetrical. There was no tenderness, no muscle spasms noted, no nodules. I'm going to now feel the paraspinal muscles. Let me know if you have any tenderness.
No. No. No.
Good. So no tenderness there, no muscle spasms. Now we will look and do range of motion. So first I'd like you to bend your head forward for me and extend it back. Good. Now I'm going to have you go side to side. Perfect. So 45 degrees on flexion and extension, 40 degrees on lateral bend. Next, I will have you bend over for me, keeping those legs straight, and try to touch your toes. Perfect. So 75 degrees there. Now I will have you extend backwards. Yep, hyperextend at the waist. Perfect. So we're at 30 degrees there. And now to the side. This side and top side. Perfect. That was 35 degrees there on the lateral bend. Now I'll have you take a seat. We will assess your periphery. So as I said earlier, skin is warm, it is dry. I don't see any cyanosis here or pallor, anything noted like that. I'm going to do some capillary refill. Capillary refill is less than 3 seconds. Capillary refill is less than 3 seconds. Now I will assess the pulses. I'm going to do radial. We're at a 2. Brachial. 2. Dorsalis pedis. 2. Posterior tibial. 2. Okay. Perfect. Now moving on, we are going to assess your sensory ability. So for this, I have a Q-tip here and also a paper clip. One is soft, one's dull. I'm going to touch somewhere on your extremity. I want you to let me know which extremity I touch and also if it's sharp or if it's soft. Okay?
Sharp. Left arm.
Okay?
Soft. Right arm.
Okay.
Soft left leg. Sharp right leg.
Okay, perfect. So sensation is intact there. There's no sensory loss. Now I'm going to assess your deep tendon reflexes. So for this, I'm going to start with your brachial. Good, we're at a 2+. 2+. Brachial radial. 2 plus. 2 plus. I'm going to bring your arm up now. We're going to do the triceps. Oh, yep, that way. Good, that was a 2 plus. And now the other side. Good, that was a 2 plus. I'm sorry, I'm going to have you now move into that chair. Okay. Good, 2 plus. Good, that was a little 2 plus there too. Now we're going to do the Achilles. Good, 2 plus. Good, that was a 2 plus too. All right. Now I'm going to take a look at your hands. I'm going to flip them over this way. So I don't see any clubbing of the fingers, no cyanosis. I'm going to feel your joints here. Is there any tenderness?
No.
No? Okay. Joints are smooth. There's no tenderness. There's no bogginess. No nodules felt. Now I'm going to test your range of motion. So for this, I would like you to just mimic everything I'm doing. First, we'll start with your hands. So I'm going to have you bring your fingers down at the knuckles. Just down at the knuckles. Perfect. Now bring them up and extend them out. Perfect. Now I'm going to have you touch the thumb to each finger. Perfect. Now make a fist. Now open up your fingers. Bring them together. Good. Now at your wrists, I'm going to have you bring them down and up. Down and up. Good. And then bend them. Bring them side to side. Perfect. Now squeeze my fingers. And push on my resistance. Perfect. Now for your elbows, I'd like you to bend them and extend them out. Perfect. And now keeping them bent, I want you to bring them side to side, like up and down. Perfect. Bring your arms up, push against my resistance. Perfect. Now I'm going to have you shrug your shoulders. Bring your arms up straight over your head. Try to bring your arms back as far as you can. Perfect. You can bring them down. I'm going to have you bring them up to the sides now, all the way up to the top over your head. Perfect. I'll have you stand up and have you kind of bring them across your whole body in the front. Perfect. Now bring them behind your back at the waist, behind your back at the head. Perfect. So upper extremity muscle strength is 5 out of 5. Now we will assess your lower extremities. So I'll have you take a step forward. I'm going to have you just kick the leg back for me. Perfect. And now the other one. Perfect. All right. I'll have you lay down here. Bring this leg up nice and straight for me. Now the other one. Now bend this leg in up to your chest. Same thing with the other one. Good. Now bring this leg out. Kick it up to the side. I'll have you flip around so you can do the other leg. Perfect. And now I'm going to have you cross one leg over the other right at the knee. Yep, perfect. And now the other side. Good. All right, I can have you sit up. All right, I'm going to have you push up against my resistance. And push against my resistance. Perfect. You might want to scooch back a little bit. I'm going to have you first point your toes. Bring them to the sides. Good. Now rotate around the ankle, excuse me. Good. Now I'm going to have you bring your toes in and now fan them out, bring them out, straighten them out. Perfect. I'm going to come under here. I want you to push on the pedal. Good. Now pull up. Perfect. Was there any tenderness at all there?
Just a little in the knees.
In the knees? Okay. So we have tenderness in the knees. They are a little swollen. They don't feel warm. I'm going to have you come up and down and up and down. Okay. No clicking or popping felt, no crepitus felt. However, lower extremities muscle tone is 5 out of 5. Now going back to your feet here, I'm going to take a look. There's no clubbing here. There's no cyanosis of the toes. The big toe, the great big toe, is straightforward. It's flat. It's aligned with all the other toes here. I'm now going to check your the vibratory sense in your toes, on your feet. For this, I'm going to strike the tuning fork, and then I'm going to put it at the tip of your toe here and let me know when you can no longer feel it.
Okay.
And again.
Okay.
Perfect. So vibratory and positional sense were both intact there and symmetrical for the feet. Next, I'm going to perform the plantar reflex. So for this, I'm going to take this foot. I'm going to bring it up. Perfect. There was flexion there of the toes. Good, and there was flexion there of the toes. That's a normal Babinski sign there. So that concludes my assessment here. My one recommendation for this new arthritic pain that seems to be happening in your knees is to start a low impact activity. This could be swimming, it could be cycling. Try to get about 150 minutes per week. This can help decrease the severity of your symptoms that you're feeling.
Okay.
Do you have any questions for me?
Nope.
No? All right, well, thank you so much for coming in today. And if you need anything at all, give us a call.
Okay, great. Thank you.
Thank you.